Hello everyone, I'm Dr. Parul and today I'm going to talk about a very common scalp condition called as dandruff. Dandruff is characterized by sticky white scales which are itchy, are dead and accumulated on the scalp surface between the hairs and sometimes fallen on the shoulders also. They may get worse, they may get better with time. They usually start in the puberty but sometimes can also directly come into adulthood and may persist for many years ahead. It may be a source of embarrassment, sometimes uneasiness also. Let us just see what are the reasons for dandruff. Now, first can be an extremely inflamed scalp condition which is called a seborrheic dermatitis, in which you have very heavy scales and you need to visit a doctor for it. Second, if you are infrequently washing your scalp, that may lead to dandruff. Third is a yeast called as malassezia, which actually increases the cell growth and leads to this accumulation. Fourth, improper hair products may lead to eczema of the scalp, and that's how you may get a dandruff. Fifth, if your scalp is extremely oily. Sixth, if you have stress and anxiety, you can get dandruff. 7, zinc deficiency, sometimes thyroid deficiency too. So these all are the reasons why you can get dandruff. So now what do we do if we have dandruff? How do we treat it? The best solution is using an anti-dandruff shampoo. Many are available in the market, and how do you pick it up? So you see compounds or ingredients like zinc pyrithione, selenium sulfate, you have salicylic acid, you have ketoconazole, sometimes coal tar. So these are basically antifungal and antibacterial properties of the products. Each of the shampoo will have one of them. So how do you start it? You start with twice a week regime. Rinse your hair or make your hair wet initially. Keep this anti-dandruff shampoo on the scalp, massage it lightly and keep it there for 5 minutes because it needs to act on the flakes, loosen it up and remove the dandruff. So keep it there and then wash it off. So use it twice a week initially, and then after that continue for about a good 1 month. If by around 1 month you do not feel any difference, you do not feel that the dandruff is reducing, you can shift on to this another ingredient. Suppose if you're using a ketoconazole based shampoo, you can go on to a ZPTO or sulfur or a selenium sulfite solution. But by around 2 to 3 months, if you feel it is just not reducing, then there is something like an alert. Go back to your dermat and ask for an opinion. There may be many other reasons why it is not reducing. Like I said, there may be seborrheic dermatitis, it may be psoriasis, it may be a deeper fungal infection, or it may be any other underlying causes like I said, thyroid deficiency, zinc deficiency, nutritional deficiency. All of these may lead to dandruff. So how do you take care? I've already told you, you start with a regime of twice a week, wash it well, keep it on your scalp for some time, clean it properly, and if it's not responding to these over-the-counter shampoos, go back to the doctor, let them find out what any other reason is. Some DIYs like lemon curds can also be used. I also recommend flaxseed oil, which helps in moisturizing the scalp surface, and they also lead to reduction in the dandruff content. At the outset, stress management, thyroid treatment, if you have zinc deficiency, should be treated, and of course repeatedly cleaning the scalp well, maybe 3 times in a week, also will help to degrease the scalp scales and keep your scalp healthy. It may recur even with this. So dandruff is you must have seen, it's a persistent condition. So I would suggest don't completely stop. Even once the dandruff is under control, you need not completely stop it. At least continue for once a week for a few months to years if you are more prone to dandruff. So with all these instructions, do take care. Any other queries, we'll be happy to solve them for you. Thank you.